Hello, everyone. Welcome to the Research Cafe. Today, in our context edition episode of 3, we are going to discuss about the pathway to become the research active clinical consultant in the UK. And for that, we have our honorable guest, Dr. Mahaza bin Islam Orin, and she is a clinical consultant neurologist in the Sheffield Teaching Hospitals in the UK. And also, she is a postdoctoral research fellow and an undergraduate and master's student clinical teacher in the University of Sheffield. So, Dr. Orin, welcome you on board. We're really glad and happy to have you amongst us. Thank you for joining us.
Thank you very much, Sadi. It's doctoral research fellow, so I'm actually doing a PhD in the University
Sorry.
of Sheffield.
Yeah,
It's all
yeah.
right. It's all right.
Sheffield, sorry.
Right.
And yeah, so we sorry, so my internet is a bit lagging. Sorry. So before like any further ado, I would like to straight go into the discussion. And so, if you kindly walk through us among the journey that you lead to this PhD until today, and what initially sparked the interest among you that you thought of combining both the clinical part and the research part together. So, if you could kindly talk us through that.
yeah. At first, I'd like to thank all of you for inviting me here. It's a pleasure. So I graduated from Dhaka Medical College and finished my internship in 2012. And then we decided to come to finish MRCP first. I have all my idea were to do a MRCP, be a clinical consultant. So that was the start of my journey. But I, since my medical school, I always had this idea that what if I have lots of papers under my name, or if I become a professor with lots of research students. So it was a bit difficult back home to combine both together. That was one of the reasons why I wanted to move to UK and pursue both together. So after I finished my MRCP, I got a job in Universities Hospitals of Leicester in 2017. I started my I was a medical registrar there, and the my research journey basically started before I came to UK. So I always one of those persons searching for interesting cases to write up or present or something like that. So I had a paper written with one of my neurology consultants in Square Hospitals and got it published before I came to UK. So that was the start, really. So I had no idea what I will be doing with it, but I just wanted to write things up and add something under my name. And then when I came to Leicester, so it was a medical unit, so not it was a very very supportive unit, but not very research active. So what I did is I always tried to find an interesting case, and one interesting case came up. It was about a blood thinner causing cellulitis. So I walked straight up to my consultant and said that, is it something worth writing up? And he said, do you want to write things up? Then why don't you present it in an international conference, which is called Society of Acute Medicine Conference in Birmingham? And I was given only one day to write the abstract, submit it. So and that was my first experience. I did it, but I had no idea how to present, how to make a poster. So I just thought that let's do it. So that was my first abstract writing, and then thankfully I got highly commended poster presentation from that case presentation. I think that turned the whole pathway. So I thought that uh, why don't I pursue a bit? So why don't I try a bit and see whether I can do something in research? And later on, I got the neurology training number in 2019. And that's really where I learned what research is. Before that, I have been doing case report, case series, audits, and etc. But that was the time when I got my mentor. I applied for a research post called NIHR Academic Clinical Fellowship, which is basically a training program. So we do 5 years of training in a specialty, and then it gives you like 25% of your time as research. So I got mine completed for 5 years, and that's exactly when I learned research, learned how it works, and etc. So that's how it panned out, and that led on to my PhD.
That's really interesting story and really motivating for sure you have. And yeah, so basically what we got from your story is like you had this writing spirit in you, and there is some certain corners in your life that actually motivated you to push it further. That's how you came this far. That's really motivating because sometimes people want to know these success stories so they can actually pursue the line you have taken. Thank you very much for that. So I'll come straight to the second question. So what resources or what initiatives that you actually took that brought you here? So what, like looking back, what do you think, what was your like success things, the strategies that you took?
I think there are two key factors that
Hmm.
someone needs to have or to become a research active person. One is the drive. I think if you want to do research in, and if it is not something that you have to do, so you can be a very good clinical consultant without having no research under your belt. But if you are someone who is interested in getting new knowledge or adding to the scientific world with your research work, then this is something that you need to have, that is drive. So by drive, what I mean is you need to find what attracts you, what specialty or what type of research attracts you, and then find a person who can guide you, because you can it's very difficult to do a full blown research without having any mentor or like a professor guiding you when you are a beginner. So it is your drive that you will find someone who can guide you. And the next thing is patience. So what I learned throughout my 5 years journey, that it does not come easily. So what you want in your clinical world, you do lots of exams, you pass your exams, you train, and then you get a consultant job. But research is a lot of uh, of more difficulty, and it is something that it has got a winding path rather than a straight path like clinical consultant jobs. So I think it's patience and drive, these are the two things that you need to have.
Yeah, thank you so much. So you were actually talking about the mentors and the like the guide you use. So do you think it's really easy to get a mentor being in the clinical job? I mean, like you're a doctor and also you're doing the research. So is it hard to pursue a mentor who's also a researcher and a clinician?
It is difficult. I will not sugarcoat it. I will not say that it is easy. But there are two things you need to keep in mind. So one is what you are expecting from a mentor, and your mentor is also looking for someone they need their work to be done with. So it is a mutual respect and understanding. So I think to find a mentor, the best thing that you can do, and that is what I have done, is uh, tell everyone that what you are interested in. So when I was in Leicester, as I said, that is a clinical unit and that was not very research active. But even though I kept on telling people that I want to write case report, I want to do publication posters and etc. And then one day it clicked. So I think it is trying to let people know, sell what skills you have, and then I'm sure you will find someone who can actually guide you.
Oh, okay. Yeah, that's really interesting because I what I get from your message is like be straightforward or be honest from the very beginning and say out loud what you want or what you are capable of. Is that what you want to say? So
Yeah, yeah. And
yeah, yeah.
one more thing I wanted to add. So when I was back home, my idea is whatever my professor will ask, I will do it here. But here, seeing other people doing their research, they only do what they want to do. So that's a clear message I want to give, is don't jump into the wagon that you don't want to drive. So do something that you actually are interested in. It's hard work. If it's something that does not attract your brain and cognitive skills, then don't jump on it. Do something that you like.
Exactly. So yeah, like being a young researcher, I myself have this confusion that what if I say it out loud by my professor doesn't like it, or there are consequences. So how do you manage this stress or manage this miscommunication?
So what it is difficult at the beginning, I must say. So what I used to do is I started with the skills that I have. So for example, I didn't have the skills of analyzing data set or doing like original research work or lab work or whatever it is. But I had the skills of writing. So I went to people and say that I can write this for you, or we can do this project, we can write this up, or I can even write up an audit project. So I always played with the skills that I have. And then
Okay.
when I had a portfolio of 10 different poster presentation on my bag, then I could go to someone that I have done this and then I want to progress. So I want to do some more research work that you have. So this
All
is
right.
how I played.
Yeah,
So
yeah, that's good. That's
they also
they
need
need
to know
to,
what
yeah,
skills you have so that you can
exactly,
get your projects
exactly.
done with them.
Yeah. So actually, it's better to show them your cards than play accordingly. Yeah, like it's really
Yeah,
important, I suppose. So
yeah.
yeah. So talking about the resources, now my question is, what were the biggest challenges you faced throughout your journey?
Resources, I think couple of things that we need to overcome in research world. One is when we do our medical schooling, we don't have much training on research. So when I came here, I almost had to start from scratch. I had no idea about statistics, how it works. I didn't even know how data analysis could be done. I was good with Excel sheet and PowerPoint, but that's what I only had, and probably a bit of writing skills. But then I think what we need to do is identify where our lackings are and trying to find how we can overcome this. And then one good thing about research world here is when you are an early career researcher, you get loads of training. So then I picked up that I don't know programming, so I learned R programming, and then I didn't have much skills about analyzing a big data set, so they provided me those training. So it's essentially understanding what you need and what you can get trained on. And the other thing which is important is time management skills, because when you are a clinician, especially when we are junior doctors, then our time is more guided by the hospital management team or training program management. So it's difficult to find a time when you can actually spend on research. So my advice for people who uh, are planning to pursue, who are juniors and planning to pursue, I think the best way of doing it is getting a research time, which is what I did with my NIHR academic clinical fellowship, where you will get 25% of research time. But it is again is it will require someone to guide you and supervise you. So it is like a cycle where you go round and round and you find the right block to put into the right another right block, and then you get it. So get good clear idea what you want, get to know what lackings you have and how you can overcome this, and then try and find a job where you can do some research. And the best thing that you can do is to find a job in university hospitals, because
Oh,
that is more you will get to know people who are doing active research. It's not that the district general hospital don't have them, but the chances are more to have
no.
in university hospitals.
Yeah, yeah. Thank you so much. So you are talking about the NIHR Clinical Academic Fellowship. So is it hard to pursue one of those? Like how hard it is, and what are the challenges of pursuing them?
I think it's again the vision that what you actually want to get. So if you want to do research as part of your clinical job and be involved in clinical trials, you probably don't need that. But if you want to want to pursue clinical academic pathway, which I will explain in a minute that what is clinical academic pathway so that the viewers can understand, then you will need these fellowship because it will guide you to the next stages and then PhD and then so on. So academic clinical fellowship is very competitive. You will probably get one or two posts in a particular region, and it is mostly CV driven. So how much of your CV already you have and how much you can do with this fellowship. They don't want you to be a professor at that level, but they want to see that you have the potential to become a professor.
Okay.
So I think my suggestion for people would be that start with the small bite size research. It could be small case report, case series, or data analysis of like 20 patient or 20 group of people, and it's just a very basic thing, but you can actually show that you know what it takes to be a future clinician and researcher. So one, get a supervisor again to get some portfolio in your research, and three, find the right specialty and right research project you want to do. So that's what you need.
Yeah, thank you so much. That was really helpful. So another thing is like you're saying that try to find your weakness and then try to rebuild on them. So is there ample opportunities in the NHS to sharpen your, for say, data analysis, statistics, etc.? Do they run training program for this?
I think it works differently. So for NHS, they want doctors who can manage patients. So it is always your or my or whoever does the research, that person's uh, drive that they will find those research activities. So what I did when I was in Leicester, that I used to pick the teaching sessions, because teaching is something that also adds onto your portfolio. So and then always keep looking for opportunities like 1 hour research training or audit training or something like that. But it will not come to you. You will need to
Yeah,
go and find it out there,
fine.
and that's where university hospital comes to place,
Oh,
because they run
okay.
a lot of training sessions as well.
So you're saying that university hospitals are more preferred over the non-university hospitals because they have more academic environment?
Yeah, yeah. I think that's my experience. Um, because it was in Leicester was an university hospital. So later on, I worked with an endocrine professor, and because I used to work in medicine, I could see people from different specialties, and that professor taught me a few things that how to do poster and etc. So I think you will get more opportunities and more um, experienced researcher in university hospitals,
Okay.
rather than district general. I think I'm simplifying things a bit much.
Yeah,
It's
yeah,
not
yeah,
that people are not going to just DGHs, but it's
yeah.
just
Yeah.
in general idea.
In general idea, yeah, yeah, you're talking about the structures pretty well.
Yeah.
So talking about the impacts or benefits of having a PhD, like do you have any added benefits if you do a PhD in the NHS?
Yeah, so that's what I wanted to discuss about clinical academic pathway. So there are three ways of doing it. So three ways of being research active, really. So the first is the I think the best way, or the usual way, and lots of British graduates do this, is they start their foundation training with research activities. They call this academic foundation program. They get like 3 months or 6 months, I don't exactly remember, but a certain period of time that they can spend in research. And then comes to the medical training and specialty training when you get into this academic clinical fellowship. Both are funded by NIHR. And then once you do your academic clinical fellowship, then you are expected to design a project which can lead on to PhD. So in my case, I learned a lot of skills for microbiome and multiomics in neurodegenerative conditions. Although I learned it in motor neuron disease, but my PhD is the same skills, but in Parkinson's disease. So that training was immensely helpful for me to land onto a PhD. And then after PhD, you go and apply for lecturership, and then eventually you become a professor if you stick onto that pathway. So that's the ideal one, and it is difficult. It's immensely competitive, but it's doable. People do, and international medical graduates also do it. So it's very doable. The second thing is you don't need to do PhD for it. If you want to do like research on the background of your clinical career, then you do all the trainings by yourself. You can expect the hospital. You can negotiate for the hospital to get you one or two PA. So PA means 4 hours of your job plan to get you for research activities. It is again negotiation is the key, and then whether you can get that approved by your management team. So that's another way of doing it. Not necessarily you need to have PhD for it. Okay. And the third one is the alternative route, or cutthroat route, cutting the crease route, I'd
Cutting the
say.
crease. Yeah.
So it is like you don't do anything. I think you need a bit of background when you are a young doctor, but then you do all your training, you finish your clinical training, and then search for a PhD job which you can do as a part-time, so part-time consultant, part-time PhD. So you can certainly do that, and then gradually you make your way through to become a clinical academic. So that's the backdoor route of being a clinical academic.
Oh,
All are
okay.
possible, all are fine, and uh, there's no reason for one to undermine the other. It's just what suits you best.
Okay, okay, that's really interesting. And I think like if someone wants to be a researcher as well as to associate it with the teaching, and also wants to see the patients, that's the best way of doing the academic fellowship plus the clinical part. Like, is that what
Yeah, yeah, because it's very
pretty
well
much?
designed. So that's
Hmm.
the reason. So you don't need to bang your head on the door because you don't know which way to go. So it's very well designed. So it's best
Yeah.
recommended.
Exactly, yeah. So thank you for that. So we're almost at the end of our session. So looking back ahead, like looking back to your journey, what will be your suggestion to the future fellow clinician who wants to walk down on your path?
Um, I think two things I want to emphasize. So the first thing is decide what you want to do. So it's not something that you become you become someone precious if you do research in the NHS. So it is what you want to do. If you can be a fantastic clinical consultant without any research, but if you want to do research, there are opportunities. So that's my first point to my fellow juniors, and just to make sure that what you decide what you want to do. And second thing, if you have already decided you want to go for research, then start early. Start writing up, improve your skills, reading skills and writing skills. There are lots of different platforms like Future Ed or Coursera. So these are like online platforms. You can find your suitable um, training, and then you can get yourself trained. And one thing I want to emphasize, and I have seen a lot of people, and I probably have done myself as well, that when we do the training, we just think about the certificate. It's not about certificate, it's about the skills that you learn from the
Yes.
training. So be very sure that what you're trying to achieve from that training is not certificate, it's the skills that you can apply in the next time. So these are the two things. Be very sure what you want to do and start early for your research and get training.
Exactly. So if someone has the drive and knows what he wants, then build up accordingly. So definitely he can pursue your path that you have chosen like that. I think it's really
Yeah,
doable.
yeah,
Yeah, yeah, it's
certainly.
really possible. Yeah, exactly. So yeah, like our last question about all this thing is like, what's your future plan and what are you planning to do after the PhD?
I think after I finish the PhD, I will apply for lecturership. So, by lecturership, it means that then you are employed by the university, but you will be able to do your clinical work and also the research work, and the research time is protected. So that's my next aim. Then because it will take me to the route to get to that point where I can pursue clinical academic role, and the final goal is to be a neuroscience professor. If it does not work, then I will still keep research, but I will do the backdoor way of being an NHS consultant, but negotiating with my management to give me research PA so that I can still pursue the dream of becoming a professor. So let's see what happens.
All the very best. It sounds really promising, and you're really inspiring for all of us. So thank you very much for your time and insights. I'm really hopeful that our audience today will be really beneficial and benefited from your advice and suggestions. And yeah, we hope to hear you from more in the future, and hope to hear from your journey and your experience and insights, everything. And thank you so much, Dr. Orin, for joining with us, and hopefully we'll see you again.
Pleasure is all mine, and I'm happy
Thank you so
to
much.
take any questions through my uh, website and blog called Plan Your
Exactly.
Post Graduation.
Okay.
If anyone is interested. Thank you.
Thank you so much. We'll see you again soon. Thank you. Okay, everyone, with this, our today's session to Pathway of Becoming a Research Active Clinical Consultant comes to an end. Hope you enjoyed it. If you have any questions, please feel free to knock in our Facebook page or our website, and we will run more of these episodes in the future. And we are really happy and grateful to have you amongst us. Thank you. With this, it comes to an end. Thank you.